Dr. Wegner, today we're going to talk about cavities. What is a cavity, basically?
A cavity, in the essence of the word, is a hole in the tooth. But more importantly, how do we get a cavity? A cavity is formed from essentially acid from the bacteria in your mouth. That's the byproduct that sits on your tooth for long enough that it actually creates a hole or a weakened spot in the outer layer of the tooth. If that happens long enough, then it turns into a bigger cavity or a bigger hole. But once it's visible and soft and sticky, where we can see it on an x-ray, that's when we say it's time to be filled. Now, this bacteria in your mouth, it loves sugar. So when you hear your dentist, they talk about sugar, I mean, that's what we're talking about. The sugar is eaten by the bacteria. The more sugar we have, the more the bacteria eat it, the more acid they create.
Oh, okay.
So not only, it's not necessarily the amount of sugar that we eat, it's the frequency.
Okay.
So if you're going to eat your sugar, this is going to make your doctor angry, but eat it all at once.
Yeah.
Don't spread it out throughout the day. That's one of the downsides of drinking soda or something throughout the day, is it's on your teeth for this long period of time, and it's doing its damage all the time.
Okay. So when our parents in the old days used to say, well, don't eat that candy because you'll get cavities, they weren't messing around, were they? They were actually correct.
Yep, that's correct. And the more sugar we have in our diet, the more likely we are to get cavities. Now, some people are a little bit more resistant to getting cavities, and some people are more prone to getting cavities. It's just the way we're made. But for the most part, if we can limit the amount of sugar that we have or the frequency of that sugar, we'll probably be less likely to get cavities.
Okay. Now, assuming, and sadly, it happens to us all, doesn't it? Say we've got a cavity. How do we now deal with it when we come and see you?
A cavity, if we have a cavity that's gone through, the decay has gone into the second layer of the tooth, the dentin, that's when a filling is necessary. Okay. And it's a simple procedure. Most people have probably had a filling, but we remove that that affected area of the tooth. Mm-hmm. Yeah. And then we kind of build that tooth up. We use a white filling. It's bonded on. It's put in there, and we make it look as close to a natural tooth as we can. We get the shade right, all those things to make it look natural.
So no more of the old metal fillings?
Very rarely do we use that, but yeah, I can't remember the last time I've done a metal one.
Anything that we need to do then when we get home to take care of it and make sure it doesn't happen again?
Yeah, I mean, I think, again, along with your diet that we talked about and sugars, another way to reduce your chance of having cavities is good home care. And that's making sure we're brushing regularly, flossing, and making sure we're getting some sort of fluoride on the tooth, whether it's through your toothpaste or a rinse, preferably both. Yeah. And that'll help reduce your risk for cavities.
Okay. What was this x-ray that you had for us here to look at?
Oh, this was just showing you, this is an example of a filling that was done. There was a cavity here, and then the filling was put in. And this is usually what they end up looking like on an x-ray when they're done. Now, it's important to note that even though this filling is in here, I didn't realize before I studied all this that a filling wasn't necessarily meant to be permanent. Oh. We can still get decay, and in fact, research shows that the average filling, a white filling, lasts about 7 years before it gets decay around it again. Okay. So that's why it's important that we keep seeing you. We take x-rays, and we'll keep an eye on these fillings to make sure nothing's going on. Okay. So when it needs to be replaced, it's not a big problem, it's just another filling.
Okay. So we now know what a cavity is, we know what to do to avoid them, and we also know where to come just in case we can't avoid them. Come on down here to Aspen Dental. Tell us where we are, Dr. Wegner.
We're 1451 North, 200 East, and that's just, if you just head north from the mall, we're right off of 14th East there.
Yeah. So you have a cavity, or you think you do, which we all do from time to time, come on down to Aspen Dental, and they will help you out.